Understanding and becoming competent in recognizing dysrhythmias is only one of the many important responsibilities the nurse has in caring for a patient with a cardiac dysrhythmia. After recognizing the dysrhythmia, the nurses must know when to initiate standardized emergency protocols, such as ACLS, or to administer medications. The nurse must also know when to call the physician and what to report about the dysrhythmia and its relationship with the patient's medical history, medications, fluid and electrolyte balance, and other symptoms, including those signalizing decreased cardiac output, inadequate oxygenation, and decreased tissue perfusion. Being familiar with the patient's past and present cardiovascular history prepares the nurse to be alert for telltale signs of cardiac problems. This helps to ensure small problems don't become bigger ones before being detected. Assessing for, documenting, and reporting signs of hemodynamic compromise, including changes in vital signs, level of consciousness, and pulse oximetry readings, will provide important information about the adequacy of cardiac output, oxygenation, and tissue perfusion. Such signs will also provide a basis for monitoring the progress and evaluating the effectiveness of medical interventions. Correlating changes in cardiac rhythm to the patient's activities and symptomology is also critical. The nurse must ensure adequate documentation of any changes and abnormal rhythms by placing clinically significant rhythm strips in the medical record. Being knowledgeable about medications the patient is taking and their side effects, especially those associated with dysrhythmias, can lead to early detection of problems and may prevent fatal dysrhythmias. Understanding the correlation between the dysrhythmia seen and the patient's fluid status and lab values, including electrolyte values, is essential to ensure that the physician receives all significant information upon which appropriate treatment of underlying pathologies will be based.